Have you ever sat in a dentist chair and wondered if you were in the right hands? Most of us have, and many of us never find out. Today, that changes because we're covering what you should see and feel when you sit down in a dental exam chair, when the chair tilts back and work begins, and when the appointment is over. Stay with us because we're going to cover the one thing a great dentist says to you, because when he says it, you'll know you're in great hands. Dr. Devigus, my daughter and I just went to a new dentist yesterday. Honest to goodness, this is like serendipity. And so I'd love to evaluate with you if their processes are beautiful or not. So when I sat down in the dental chair, the hygienist took photos of every single one of my teeth. Is that a beautiful or not process?
Well, that's an interesting point because if we talk about dental photography, we're talking of something that many patients never experience. And maybe I have to explain to you. This is because dental photography is not taught at 73% of dental schools. So dentists don't learn that they have something important at their hands. It can also be your smartphone. You don't need like I'm using professional gear, but it also your smartphone is good enough to start to take pictures of your patient. And imagine we have two ways to look through and at our patients. X-rays, that's to look through somebody, and the picture is to look at somebody. And it's interesting that from my point of view, this separates the dentists, hygienists, dental experts from the average, those who take advantage of using these tools. Because as you mentioned, as a patient, you say, wow, this person is taking care of me. She or he is examining, looking for details, wants the best for me. And this is the message. It's not wasted time or wasted energy, but communication. It's all about communication. And we will talk about that later as well.
Today, we welcome Dr. Alessandro Devigus, who was editor-in-chief of the International Journal of Aesthetic Dentistry for 17 years. Dr. Devigus, we are happy you're taking time to talk to our Beauty Seat community.
So thank you very much for inviting me.
Back in the day, one thing I remember when I got clear aligners was it was kind of a wand that they waved around my mouth, but I don't ever recall a dentist using that tool. Is that a beautiful practice or not for a dentist to use that wand tool?
Oh, are you talking about an intraoral scanner? So taking an impression?
Yes.
Okay, yeah. When you today, I would say all dentists who do aligners, or maybe the majority of dentists doing aligners, don't use the conventional impressions anymore. So like the gagging reflex and taking time. So I would say scanning your teeth, creating a digital version of your bite, of your upper and lower dentition is standard. I would say in a modern dental office, if you don't see that, you have to really ask, am I in the right place? Because the price also has dropped down. And if you calculate all this also from the side of the dentist, of the investment that you need to do, it's really worth it. So it's something that very soon gets paid by itself with the time you save, the patient comfort. For me, one of the most important factors is always that my patient or the patient in general is comfortable, is feeling good in the chair. And if you have easy to access tools, there's so many scanners on the market, and that most of them work really great, that somebody who's not going or jumping on this, well, I have to say, scanners exist for 40 years already. That's not something new. You know, I started doing scanning in the late 80s, 1980s, and now it's really popular. And you experience something that for me should be the standard care of of modern dentistry.
I think that I would have been really impressed, and I've never had a dentist do it because when I did it for, clear aligners, right on the monitor, you could see it was just kind of rendering my whole bone and shape of my mouth. Felt really confident that they had a good understanding of my anatomy.
Absolutely. Absolutely. It's implementing these tools to visualize because, again, let's come back to communication. The most important thing, not only at the dentist, it's also if you go to your hairdresser. You sit in the chair, the hairdresser holds your hair, feels the hair, and says, "Hey, Sam, what are we doing today?" And then you start talking, you start communicating. What do you want? What I would suggest. Basically, also at the dentist, it's about not say, sit down, rinse, please, open your mouth. Does it hurt? And I always take these words and say, we have a lot of dentists that have depressions because they are seeing so many people all the day, but they are not talking to them. So they are non-communicating. And if you are non-communicating, you close yourself, you get isolated. You know what I mean? So it's important to communicate. And not only these days. So I remember today we had a patient that was in a wheelchair and he has like cerebral problems since his birth, and he's so afraid of the dentist. So he was sitting in the chair. We managed to bring him in the chair, and he was crying. So we had to first start connecting to the patient and feel or ask him about the fear he has because he had several extractions done under full anesthesia, and so he has a bad feeling. And he was always saying, "I have a bad feeling. I don't feel good." And this is the point. So our goal is to make the patient feel relaxed, comfortable, to create the trust. So if you're sitting in the chair, you should say like, "Oh, I'm relaxed. Nothing can happen. I think the doctor has, or the hygienist, or whoever is treating me, ha- has it has the right feeling, the right emotions, the right skills." So you feel also that somebody is confident sitting in front of you, and that's it. So it's not like I'm joking and say, "Okay, today it's the first time that I will do this." And then people are looking at me and say, "No, no, no, I'm kidding." So, but basically, but this is no, honestly, it's important that although you're doing the same thing over and over again, you always need, it's always important to remind yourself to repeat the steps you're doing in your brain. I feel like being a pilot, and we were talking about when we met the first time, the mise en place, so that everything is ready before you start, and that you go through all the things and say, I need 5 instruments, I need this material, I need this, I need that. Is everything here? Okay, now let's go. And this is like my routine I have before I start any treatment. I double check. For example, you can do the anesthesia, and then I tell the patient, now I'm preparing everything. Because if I would just make the anesthesia and sit there and wait for 2 minutes that it makes effect, this is like strange. And then the 2 minutes, they feel like half an hour. But if in the meantime, in these 2 minutes, I get everything prepared, so the patient feels something is happening, and I tell the patient, now I'm preparing everything that we are ready to go. And so this is like my routine, to always involve the patient, not just let the patient be there and not knowing what's happening next.
It's so true. And I love your comparison to a hairstylist. When I go to a hairstylist, I want to be there longer. The dentist is like, get me out of here as fast as I can.
Yeah, it's interesting that a lot of people would be ready to spend more to get out earlier, faster, It's that interesting, and that's, for example, an advantage of doing chairside dentistry. What I talked to you about when I was a student in the 1980s, that our professor was who invented this CEREC system. That's a CAD/CAM system. That's a system where you scan. So you prepare the tooth, you scan the tooth, you design a restoration, you mill the restoration, and you bond it in, and everything is done in one session. And this is chairside dentistry. And patients say, okay, if I only have to come once to fix my tooth, if it's $100 more, I don't care. But I only have to come once, and these are all the advantages of being also efficient in what you're doing.
I love efficiency. Thank you. Back to my dentist appointment. The photos they took of each tooth were then displayed on a monitor, and the hygienist told me what was going on tooth by tooth. Do you consider that to be a beautiful practice or not?
This makes sense. Not maybe you don't need to do that all the time. So I tell people you need to feel also, especially if you're talking about the first appointment. I think it's important to not just use your mirror and your explorer and work around the mouth, and the patient doesn't know what you're doing. It's better to. It's like the thing we say, show, tell, do. So so take the images, show the patient what's going on, and then explain what the next steps are, or and again, visual communication is easy, efficient, and creates also trust. If I show you something and you see it, you trust me. If I tell you there is something behind there and we need to do that and it costs $1,000, you say, I'm not sure. Maybe I will go to another dentist and ask if this is really something that needs to be treated. But if I show you, you see it and you can make a decision.
Yeah, it did make me feel confident where I could really see
Yeah.
where the issues were. After the hygienist was finished measuring my gums, 1, 2, 1, 1, 2, 3, 2, 2, 1, the dentist then came in for a visit, very briefly, and she felt around my facial bones, but I don't really recall that we spoke about, my anatomy. Is feeling facial bones a beautiful practice or not?
This belongs, especially if you come for the first time. It's not the bones, but it's more the muscles. It's you touch, you touch the muscles. Okay, you feel the bone if there's any in anything that is not symmetric. So you're checking for symmetries or asymmetries, and then the most important thing is to check the muscles. So you go in and press to feel if a patient is, let's say, has a hyper activity on their jaw muscles, and if you press them and you feel pain, then this is a sign that somebody, for example, is grinding at night or doing anything. Or if you have headaches, so you have like the big muscles, so the temporal muscles, the muscles, the jaw muscles, and these are connected also. And something that you always need to ask is the patient: do you sleep well? That's a very important question. Do you sleep well? Do you have problems? Then looking also, are you stressed? And these are, because in dentistry we have in front of us a patient, and it's important that let's say, attached to the mouth and the head, there's also the rest of the body. And this is one important part. And it's interesting that over the last years, dentistry was always like a little bit excluded from medicine. These are the guys that are working on the teeth, but teeth, okay, are not so important. And now we are getting more and more information that the connection between oral health and overall health is bigger than we might think. Oh, and so the dentists are entering finally also the circle of information and all the stuff that we are talking about, longevity now. It's a little bit a buzzword, but basically what is important is your mouth, your oral health is way more important than you think. It's not just that you need your teeth to bite and to smile. You need the oral cavity is the entry point of so many things, of everything, and that's why we need to take care, but we need also to take care of the surrounding tissues of everything. Because, a smile when you smile, you activate, I think, 75 muscles or 80 muscles. So it's smiling is very complex. So it's not an easy expression. There's not just one muscle that gets activated when you smile.
Yes, and I feel it. It's connected down my spine almost, my face feels connected to my body. So it makes sense that we would appreciate dentists in the, kind of physician community.
Absolutely.
Right. We appreciate every beauty seeker in this community. And if this conversation is opening your eyes to what great dentistry actually looks like, hit subscribe. The more subscribers, the more expert practitioners we can interview for you, like Dr. Devigus. Hang tight because he's going to share one of the most important phrases that indicates you are in good hands at the dentist office. Dr. Devigus, back in the day, I recall having a big piece of rubber placed over my teeth when I was getting, I think it was a protective filling. Are those beautiful tools still used in dentistry or not anymore?
Well, first thing, when I place this, we call it rubber dam. And it's interesting. It's because it's of rubber, and the dam because it's holding back the saliva. And I remember a few weeks ago, I placed this in the patient mouth and explaining them, it's the rubber dam. And then he say, then I am the lake. So they say, yes, you are the lake because you're producing saliva and we're putting this over your teeth to isolate the working field. So separate. You can imagine that if you put this over your tooth, the tooth stands out. You have this rubber around the tooth protecting, and it's like working outside your mouth. And the rubber dam was invented in 1850.
Really?
Yes, it was invented when they realized working with amalgam, which contains mercury and several metals that are not really healthy, that it would be nice to have something to protect the patient or avoid that he's ingesting some of these materials. So there are two things that the rubber dam is used for: to have a dry working field, especially if you do bonding. So if you bond any on the tooth surface, you don't want saliva, blood, or anything else to interfere with that. And then also when you, for example, you do endodontic procedures, then you rinse with hypochlorite and all this stuff. So you don't want that the patient is swallowing this. And it's interesting. There's a huge debate about rubber dam in the dental community.
Really?
If you read the literature, you should use it. But there are some limitations, or there are situations where you are not able to use it. If you have a patient with a small mouth opening, with a gag reflex, with fears, with whatever, you cannot always use it. You should use it wherever you can, but there's like a discussion. A dentist that told me, I never have worked without rubber dam. And they say, yeah, okay, come on. It's like I never drove too fast. They say, so don't tell me, or I never have done this or this. But you don't need to find an excuse or tell people that you are the Mr. Perfect or the whatever. The fact is, I made an interesting post then on my LinkedIn account that let's say it's the minority that is really using rubber dam on a regular basis. Yes, that's really the fact. The reality is, if you're talking about this, it's good if a dentist is using this. It's not that if a dentist is sometimes not using it, he's a bad dentist. It's important that, for example, if you say, oh, last time you used it, why are you not using it this time? Or I explain to the patient, or some patients and ask me, last time you put this blue thing on my teeth, why not? Why not today? Yeah, because we do something different where I'm not able to put this on your teeth. So like cementing a crown that is very deep. So I'm not able to do this. So again, it's important that you as a dentist explain to the patient. So I explain to the patient why I'm doing something, a certain procedure. And I ask the patient if it's okay that I comment on what I'm doing. Some patients don't want that. So they would like prefer to close their eyes, open the mouth and say, oh, come on, do it and tell me when you're finished. And then I will open my eyes and it's okay for me. But I would say the majority of patients appreciate if you explain what you're doing.
I do. And I think the beauty sleep community does as well. That's why we're all here to just get a bit more educated about what's happening to our bodies. The dentist who came to look at me after the hygienist was done came in very briefly. And we should talk about that because I know you have opinions on how much time the dentist should be spending with the patient. But she was wearing lights between her eyes and something over her eyes throughout the whole consult. Is it beautiful or not to be wearing those types of tools during a consult? Today, we welcome Dr. Alessandro Devigus, who was editor-in-chief of the International Journal of Aesthetic Dentistry for 17 years. Dr. Devigus, we are happy you're taking time to talk to our beauty seat community.
So thank you very much for inviting me. So I love wearing loupes and a light. So because this makes the difference. I remember when I was a student, this was not so popular. We had one professor with like a strange thing that was in front of. It was like a magnification glass that we knew from people working with watches, so watchmakers. They also have like a magnification, a loupe, because they're working with tiny materials, with tiny pieces. And in dentistry, it became popular and more popular. And there are some dentists that even say, I work with a microscope, so with even higher magnification to see more details. So if you work on a regular base, I would say a good hygienist should wear loupes when she's working because she sees more details. You see more details. It's not mandatory, but I would say if your hygienist or your dentist are wearing loupes, he shows that he wants to see more. He wants to get the details, and he cares also about his work and he cares about the patient. So for me, it's a commitment. If I'm wearing something that helps me to see more, to get better information, this is something that it's an investment. It's not cheap. A lot of young people say, yeah, I don't need this. Well, they might see, okay. But if you start with working with magnification, you say, why was I not working with loupes before? I see so much more. So this is really magnification today, and also working with a light that is always where you look at. So it's like following you. It makes things so much easier, less stressful for the dentist. It's not only for the patient, but the benefit is also on the side. And today we are working with so-called ergonomic loupes. So basically the standard loupes are mounted on your glasses and you look straight. So you have to tilt down the head to look when you work. So you have to look like this. With ergo loupes, you look straight, and the loupes are like looking into the microscope. So the loupes have an angle. So if I want to look down, I have to look straight. And this gives you a better posture. One of the big problems of dentists is I don't have. I'm lucky that I don't have, but having back problems or shoulder problems. So, and this is something that is really important to have. Or if you don't use these ergo loupes, that from time to time you sit up. Also when you're at home, sometimes when I'm in front of the computer, I'm like this, and then after 50 minutes, my wife tells me sit straight. And then you sit straight. And sometimes if you're sitting in front of your computer and then you stand up, you say, oh, my back is hurting. And the same happens even if you're sitting in front of the TV and you're feeling like comfortable in your couch, and you feel comfortable after 2 hours of watching a movie. You stand up and you feel like, you have a hard time to really get into motion again. So you have to change your position from time to time. And also when you're working as a dentist or working anywhere, it's important to not stay in the same position for too long. So this is something important. And then something that might be a tip for the dental community also, I always use both hands. So I'm not working with an assistant. I'm working myself with the patient because I'm floating around my patient when I'm working. So I don't want to only see from one angle at my patient. It's again, and we can go back to the hairstyler. The hairstyler is not cutting your hair just from one side. He's going around you to see how do you look from all angles. And it's the same if you're working on a tooth. You have to be careful that everything is correct, and you can only check if you go around your patient and see it from different angles. So this is the important thing. And if you're using both hands, I always tell people it's an easy exercise. If you sit straight and you lift just one hand and you turn your upper body, you feel tension in the back. If you do the same, lift both arms and do the same movement, there's no tension because the system is balanced, So this is something that is really important, that we as people sitting in the chair in front of a patient, concentrated, working in a small field, we need to relax from time to time.
This makes so much sense. I mean, the last thing I would want is my dentist to be in pain because they're kind of in a certain position all day. But you did bring up another interesting point, and you mentioned that the hygienist should consider wearing a loop. I don't think I've ever had a hygienist actually wear any kind of eye, loupes or things like that. That makes sense.
I would say that highly motivated dental hygienists, they want to go the extra mile. They want to be better. And if you want to really reach a higher level of your treatment quality, you need to work with magnification. So with loupes. The thing is that in many dental offices, they don't get the loupes paid by the owner of the dental office. So it's sometimes it's a question of investment, and the hygienists say, if they don't pay me or if they don't get me the loupes, I don't wear them. So sometimes it's also, and if the doctor is not wearing loupes, he will not buy loupes for his dental hygienist. So that's an ongoing discussion. You can do your job without loupes. It's okay, but you will, if you start using it, you will not go back.
I can imagine. So that's a great sign. If you see hygienists wearing loupes, okay, they're really committed to the detail. The other thing you said, and this is fascinating because yes, my hairstylist will walk around, spin the chair, keep looking at me from all angles. I don't think I've ever had a dentist get up out of the chair and look at me and take a look from all angles. I had an orthodontist once who got up and looked at me, from straight on, but I don't think that I've ever had that happen.
Yeah, it's maybe it's laziness. I don't know, or if a dentist is really used that an assistant is always sitting on the other side of the chair, and if somebody's used that somebody's assisting for anything, and if you ask a dental assistant, for example, if a doctor is doing endo treatment and has to rinse for minutes and doing the same thing over and over again, and the hygienist, that the assistant is like sitting there and she has nothing to do. She has nothing to do. So when I started working in my dental office, I realized that my assistant they get bored. They say, "Yep," and I prefer to tell them, "Look, go and do other stuff. If I need you, I will call you." And if you start changing a little bit this mindset to say, it's like sometimes at home when we do when I help my wife to hang up the curtains, and sometimes say, "Please give me this," and then she's saying, "I'm not your dental assistant." So it's how you work, and there are different approaches. But I think everybody should try this and do it once or twice and feel the difference. It's not that it's that you have to. There are so many ways to work, but I think this classic way of having the assistant there from all the time, so that the assistant sits beside the patient, the doctor sits there, and then nothing happens. So basically, they stay both in their position. I think this is not modern dentistry.
I love that. I think that is a fabulous way for dentists to kind of reconsider this whole communication with the patient.
They say, yeah. And because at the end, you are with the patient, and if somebody else is also there in the room, you might say, okay, we have always the doors open. They say, in our operatory, also the entrance of our dental office is open. The door is open. They say, yeah. They say, because we have a whole floor. So, and it's like two parts of the dental office, and the doors are always open. Because for me, it was always, if somebody enters a room and the door closes behind you, you're trapped. They say, yeah. If the door stays open, and also in our office, the entrance area is very big. They say, yeah. They say, so yeah. A woman is coming with the stroller with the kids, so she has space to enter the office. It's not that she's trapped and say, "Oh, where do I go?" Or somebody or a patient comes with a wheelchair, so they enter the room and they know they have enough space. They are not trapped. We don't want to hurt them. They are free, and this is like the first impression. If you enter a room, you should have space.
It's actually a life need to have space. I love that you're considering that in your environment. Dr. Devigus, we are happy you're taking time to talk to our Beauty Seat community.
So thank you very much for inviting me, and the pleasure was on my side. Weeks ago, I placed this into patient mouth and explaining them, it's the rubber dam, and then he say, then I am the lake.